Hi, welcome to the course. My name is Fuad, and this video series will help you understand your reading material, assessment, and health professions education. Now, I'll point out to you in this series what's important, what's not so important. So, let's go right to it. Okay, now he goes on to discuss after introducing the concept of purpose driven assessment. Then he goes on to discuss in this book, in this chapter, how we understand our purposes. So we start off by first step to thoroughly describe our target attribute. Now, we have talked about it a bit in the first class. We talked about clinical competency. We talked about Miller's pyramid. We talked about ways in which people described medical competency, the CANMETS documents, the ACGME, the Australians have discussed, and in the Malaysian context, we have discussed about the outcomes that the Malaysian qualification framework version 2.0 have outlined. Now, this is part of this discussion about the attribute that we are measuring in our candidates. So we have to be clear on that. We have to have it documented that we are measuring such and such. Okay, so he goes on to give an example about unprofessionalism. If we are measuring about unprofessionalism, then what are the issues, the concerns underlying it? And we also need next to consider how we want to use this course, right? And under this discussion, under this paragraph, we come now to issues like, is it norm-based or criterion-based? Is it formative or summative? Is it high stakes or low stakes? Now, those issues come into play, right? We also have to think about it and be deliberate about it, and if possible, document it. Now, purpose-driven assessment is rather purpose-driven assessment and related to validity is rather a new concept. Even in this book, the first edition does not include the discussion on this in the chapter of validity. Okay, so it's quite new, and in Malaysian concept, in the Malaysian context, uh, for example, in the accreditation document, we still do not find any documentation referring to this purpose-driven assessment clearly, right? But it is coming, and it may be well worth your time to understand about this purpose-driven assessment. So, going on regarding purposes, we also have to broadly consider the goals as well as anti-goals, right, for pursuing an assessment endeavor. And that is what you hope will and will not happen. What will happen by using that assessment? Not just we can know who are competent and who are not, but perhaps by doing a such and such assessment, we hope that our students will behave, will respond in a certain way. For example, if our students are not going to the ward because there are no assessments that look at their clinical skills, then we introduce a clinical based assessment, maybe a new OSCE or a new form of assessment, in the hope that they will go to the wards and practice their clinical skills because they know it's going to be assessed. Okay, so consider all those. Then we go to the next section, tying methods to purposes. Now, in other words, how do we operationalize our intentions, our purposes which we have thought about? Okay, this is where he introduced the concept of our assumptions and logical arguments, and he gave an example of assessing the attribute of conflict management skill. How do we want to assess conflict management skills in third year medical students? We will do that by having the third year medical students converse, talk with simulated colleagues or patients. So we hope by doing that, what will happen? It goes on to explain that. And what are the assumptions underlying our decision to have them speak to stimulated patients? How will that measure conflict management skill? And he goes on to list the assumptions up until 14 assumptions just on that assessment of conflict management skills. Now, even he's saying that this is admittedly a long list, but it is the power is it is thoroughness. So the more thorough you think about your assumptions, the better will you be uh, to investigate whether your assessment really meets those assumptions or not. Okay, because he says if any one assumption is severely broken, later assumptions might be difficult or impossible to meet. It's like a cascading effect. If your assumption is broken in one place, the things which follow might not be true. Okay, right. So before he introduces a formal framework on how to think about these assumptions, these issues of purpose and things like that, he mentions in the section investigating validity, evaluating quality, he mentions the few terms. One is validity investigation. Now, you might come across in the literature people referring to uh, validation of an assessment. Now he is proposing we do not use that term, but we use instead the term validity investigation. Now, for me, you can take both, okay, but please be aware what he means is that he explains why he does not prefer the word validation, uh, and what are the things that we do. Basically, if it is looking back at our assumptions, and often by using the frameworks which we will discuss later, we go on to investigate our assumptions and find evidence to prove that our assumptions were correct or otherwise. Okay, that's what is called as a validation exercise, assessment exercise, or as referred by the author as a validity investigation. Okay, and he also introduces the concept of quality evaluation. Okay, he says asking is pursuing this assessment endeavor accomplishing what I hoped it would without too many negative consequences. All right, so he says this is a somewhat separate question from the earlier one, and so I propose calling that a quality evaluation. So you're looking in a wider scope, in a wider border, I suppose, and looking at the impact, the consequences of your assessment, not just pass fail. What happens after that? Now he calls that a quality evaluation. Okay, and okay, he mentions here, I believe that there is a risk of seeing assessment, development, and evaluation as formulaic and technical. You understand what he means when we discuss the following sections of the validity frameworks. People might just think, okay, there's a checklist here. I will just go through the checklist and prove that my assessment is valid. No, he's saying that uh, there is no one gold standard assessment design, nor is there a universal best possible design of a validity investigation. So you don't just go through a checklist. It all depends on your goals and context. However, I believe there are best practices that you can follow, all right? And he also says that with a clear view of what you're trying to accomplish, technical standards and the theoretical guidance become very useful to help shape your critical thinking. All right, so that is the concept of purpose and purpose-driven assessment. And then he goes on to introduce two frameworks which we can use to think about the validity of our assessment.